Hello, everyone, and welcome to Heads Up, the weekly podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, chronic daily migraine survivor, and founder of the Facebook group Migraine Nation. I'm here this week with somebody awesome and fun. This is Kevin Lenaburg. He is the executive director of CHAMP, the Coalition for Headache and Migraine Patients. So hello, Kevin. How are you today?
Doing great. Hello, everyone.
Thanks for being here with us.
Of course.
So today we are discussing advocacy and outreach and some of the really awesome things and resources that are available to us as people with migraine that I think most of us really are not aware of. And I want to make everyone aware of it because it's so helpful. So Kevin is a unique leader and advocate in the migraine community. He does not actually experience migraine himself. He is the caretaker for a loved one who has chronic migraine, and he has used his talents to become what, in my opinion, is like a super advocate in the migraine community. And then he's become the executive director of CHAMP. So without any delay, I am going to turn the attention to him, and I'm going to have him explain what CHAMP is. So Kevin, CHAMP is a unique entity. Can you please tell us what it is and how it came to be?
You got it. So about 2 years ago at the American Academy of Neurology, a number of the patient advocacy organizations that are really the leaders in the headache and migraine space, such as NHF and the American Migraine Foundation and Miles for Migraine, were all together at a bar, as one does, and where all the best things happen. And Dr. Bill Young was there, and they all said, this is great, being together, talking about our shared programs and the ways that we are addressing common issues and how we can work together and support each other. We should do this more often. So the idea was formed that if there was a coalition that would bring together the leading patient advocacy organizations, some of the leading bloggers or patient opinion leaders, and some of the leading for-profit communities that do communications like a migraine.com and a Migraine Again, bring all of those groups together, that our disease state could make so much more progress and would be so much more effective. So they literally charted it out on the back of a napkin at a bar of what this coalition would look like.
And everything amazing is on the back of a napkin. Yes.
Exactly. And so that was really our origin story. And it happened very quickly. And so Shirley Kessel was the initial organizer. And then very quickly she realized it was a lot of work to organize a coalition. And she had a full-time job running Miles for Migraine. So they were looking for someone to do this. And one of the people they involved early on is Katie Golden. Many people know her as a leading migraine patient advocate, and she is my beloved girlfriend. We've been together for many years, and I've been on this journey with her where her migraine had gone from episodic to chronic, so I had seen it firsthand. And my background is working in PR and health advocacy and coalitions. And so it was really an amazing opportunity for me to take that professional experience that I had and do it in a disease area that I care so much about and want to see so much progress made.
Right. Okay. Awesome. So you already sort of went into my second question. I was going to ask you, it was going to say you don't have migraine yourself. You are the caretaker for someone who does. What can you tell us about the challenges you face as a caregiver and how it shaped this role for you in the migraine community?
So the benefits are that I see migraine firsthand. I live with it every day. While, as you say, I don't personally experience migraine attacks, I see the devastating impact that this disease has on people, how it is life-altering, life-changing, the pain that comes with it. I know deeply that it is not just a headache. There are so many other symptoms involved. And so I have the benefit of understanding it at that deep personal level. The challenge that any caregiver has is, any disease comes with challenges. Migraine, it is incredibly debilitating. It comes with pain. It comes with mental fog. It comes with exhaustion. And also comes with unpredictability, not knowing when those attacks are going to happen and how that really puts a strain on lives together when you're trying to make plans together. So it's definitely reordered our life. And I know that it's done that to so many people across the country and across the world, but we're trying to make the most of a tough situation. And she had, in a beautiful way, reinvented herself from, she had been a vice president at a bank to she became a writer at migraine.com and a patient advocate. And now me working in the same space, a chance to work together and try to make progress and improvements for everyone living with this disease.
Yes, it's an awesome story. It really is. I personally believe that for some people, whether they're patients or caregivers, advocacy can be a really important part of our healing journey. So, can you tell us what the best way is for people to start on their advocacy journey?
So advocacy can mean so many different things.
Hmm.
It can start at a very simple level, which is sharing your story, letting other people know that you have migraine disease and this is how it impacts your life. And just sharing that information is hugely important. And then you can certainly go from there. You can do volunteering with any number of organizations active in this space. The CHAMP member organizations are always looking for people to help out, to take a really big step, like being a participant in Headache on the Hill, which happens
Hmm.
every year in February, where they bring people together and go up to Capitol Hill and talk about policy and advocacy issues. So there's a whole spectrum. Like migraine is a spectrum disease, there's a spectrum of advocacy, and people
Hmm.
can start and they can ebb and flow as their interest in time and health allows.
Right. So you mentioned sharing your story. Does Champ, this is a very important thing. Champ, I've heard Champ speak about this before. Is there a way that Champ has for people with migraine to share their story? Because that has been shown to be a very healing process for people.
Yeah, it is. It is both healing at the individual level, and it's one
Mhm.
of the most well-proven tactics for overcoming stigma. We
Right.
recently had a stigma symposium, and lots of different things have been tried in lots of different disease states. But one of the key findings that was shared by us by really the leading stigma researcher in all of disease in the U.S. said contact. People sharing their story is what
Mhm.
overcomes stigma. Let people know, hey, I'm a real person. I'm someone you care about, and I have this. So stop stigmatizing this disease.
Mhm.
Understand the seriousness of this disease. And while it's a spectrum disease, it's a serious disease, it's genetic, it's neurological, it's not just a headache. So
Right.
we really encourage people to share those stories. And CHAMP members have a number of different ways to do that. And we've organized all of those at the CHAMP website, which really
Right.
serves as a repository of information about the programs, resources, and offerings of
Mhm.
all of our members. So if you
Mhm.
visit our site, there's a tab that says Get Involved. And on
Mhm.
there, there's a share your story link, and that connects you with all the different ways that you can share your story online and guidance on how you can really craft your story so you can share it in your interpersonal relationships, the
Right.
conversations you have with your friends, your family, your coworkers. Because as we all know, so often the stigma comes from the people that love us. And that's
Yes.
often when it hurts the most. And that's why it's so essential that you share that story and you continually work to improve their understanding and empathy towards this disease.
Yes, I love that. I hope people go there. I hope that they learn better ways and get more courage about sharing their story. I think that that's such a great thing. I also wanted to ask, are there other ways, whether it's on the CHAMP website or anywhere else, what are the needs, the current needs of the migraine community? Where can people go if they want to get involved in other ways?
Yeah, so there is a new database that's just been created by Shades for Migraine, which
Mhm.
organizes every year on June 21. And
Okay.
so there's a link to it from the CHAMP website, get involved and volunteer. And basically you enter your information saying, hey, here's who I am, here's what my skill set is, here's where I live, here's what I'm willing to do. You
Right.
get entered into this database, and all the member organizations of CHAMP have access to this database. So as we have need for writers or photographers or event planners, whatever it is, this
Mhm.
is a place where we can go to. We can reach out and say, hey, here's our need. Are you interested in volunteering to help with this? And create an on ramp for more people to be engaged in these efforts.
That's awesome. That is really a great thing. So, I wanted to bring up Retreat Migraine. Retreat Migraine was put on by Champ. This year was the first year. I was totally privileged to be there and to be involved and to see it and experience it as someone with migraine. And it was so awesome and amazing. And I want to make sure that everyone hears about it and is able to be there the next time it happens. So please tell us what it is and how we can get there.
Yeah, so Retreat Migraine is a patient education conference focused on migraine. We had our first one this year, as you said. It was 3 days long. We held it in San Antonio. And, the first time doing anything, you don't really know you have high hopes that it's going to be successful, that people are going to get value out of it.
Right.
And it surpassed our highest hopes. It
Wow.
was a lot of work that went into it. Credit to Eileen Brewer, who was the director of the retreat, who worked incredibly hard. It was her vision to start this and her hard work that made it happen. And all of the CHAMP member organizations, they led the sessions, they volunteered their hours on site, beforehand, afterwards, you name it. It was only because the whole CHAMP coalition community came together, got behind this, brought their expertise and their efforts, that we were able to pull this off. And so
Right.
it's just incredibly rewarding to hear what it meant to you to be there and to so many others. And I'm
I
thrilled to
love it.
be able to announce that we have approval. We're going to move forward with
Uh-huh.
doing it again next year in
That's great.
2020.
Yeah.
We are currently working out all of the logistics. I don't have a date or a location to share, but
Mhm.
we're figuring that out in the coming weeks and months. And
Mhm.
everyone should stay tuned, because we anticipate we're going to grow it, but there's a limit to how big we can get. And so,
Right.
this first year, there was a limited number of seats.
Mhm.
So we did a lottery, and we'll probably have to do a lottery again for people to get accepted to it. But we
Okay.
really, we want people to come. We want a national representation, and we definitely don't want finances to be a restriction. So we
Right.
have support in place for people who need it, because anyone who gets accepted, we know how important this event can be to them, and we never want a financial restriction to be the barrier.
Right. Okay. So yes, definitely stay tuned, everyone. It is well worth it. It is awesome. So much to learn and experience there. So my next question is, I know one of the goals of CHAMP is to address migraine stigma.
Yep.
And I wanted to ask what it is CHAMP is doing to address that, and to also educate people on how to address it in their lives.
Yeah. So stigma can take so many different forms. There's the self-stigma people feel about themselves and what this disease, and it gets people down, and they start
Mhm.
feeling that they're not worthy of medical treatment, those types of things. There's interpersonal stigma, like I say, the shaming that happens between
Mhm.
family members and people you interact with one-on-one. There's
Right.
cultural stigma, the way this disease gets talked about and minimized, things like migraine pose and other offensive things that minimize how serious it is. And then
Which, in
there's
case
structural.
people don't know, let's just tell them it's like a pose that was started and it sort of went all over the internet, where people that clearly did not know what a migraine was and had never experienced it were just sort of sitting there, in these silly poses where they had this little headache, and it was sort of horrifying to people who really know what a migraine is.
Right. And
Mhm.
so the community organized around that, pushed back, got them to move away from the term migraine pose. Unfortunately, they just switched it to headache pose, which was like, well, that's not, not as bad as migraine pose, but it's really not what we were asking you to do here. We're asking you to be more understanding and not have any pose at all that's connected to something that's painful and debilitating. So we I call it a partial win. We had some success, but really, as our community grows, as we get more advocates involved, we're going to have more success
Right.
getting people to respect this. And so, what can people do? Like I say, sharing your story is the number one thing you can do. And then if you want to take those additional steps, visit the CHAMP website, and you'll see all the different ways that our member organizations create opportunities for people to combat stigma. And there's a whole range of things that people can do. So go there, find what feels right to you, and get engaged at the level you're comfortable with.
Okay. Awesome. Well, is there anything you would like to add on our conversation about advocacy and outreach?
I would say that migraine is a challenging disease, and
Mhm.
anyone who has this is really a superhero. You are able to overcome the pain of this condition, the unpredictability of it, and really that if we can harness that strength that everyone has within their own lives to deal with and manage this disease, and put it towards collective goals like
Mhm.
combating stigma and having advocacy, so we can overcome these structural barriers, I know it's going to be incredible what we can accomplish. So I just encourage everyone to get involved. I know that it's hard sometimes when there's a lot going on. You're dealing with pain, mental fog, you name it. But to the
Mhm.
degree you can, give that little bit extra. And if everyone gives a little bit extra as a collective group, we're going to make amazing progress.
It is very true. And remember that what we overcome to basically get out of bed in the morning, many of us,
Yep.
is more than most people overcome in a day, or sometimes, a week. So you are very strong, and it oftentimes will make you feel better to find just that little bit of energy to advocate for yourself and for the people like you. So, you know, get online and find a way. So
Absolutely.
this is Lindsay and Kevin signing out for this week's episode of Heads Up.